right? One of the most common things with ACL injuries, does the fibular head move, right? So you have your tibia, you have your fibula, and the fibula has to spin, right? If the fibula can't spin and you plant, where's all that force go? Right to the knee joint, there's your ACL tear. But if I can ensure the best quality tissue possible all the way up and down the chain, that's going to give me my best chance not to be injured.
Hello, friends. Welcome to the weekly episode of the Mayn Idea podcast, where today I have the pleasure of sitting down with Geoff Rose. A quick reminder for those that enjoy this podcast, please take 30 seconds and leave a 5-star review on Apple, Spotify, or wherever you catch your podcasts. Additionally, please subscribe to the YouTube. This helps the show get discovered organically and helps me continually bring on amazing guests. Also, there are now timestamps in the show notes, so feel free to jump around, although I recommend listening to the episode in their entirety. Geoff is the founder of Rep Athletic Training Facility in New York and the Rep Athletics app. In 2014, Geoff became ELDOA certified, which we talk about at length on this episode. I came in contact with the ELDOA protocol for decreasing joint pain and improving posture while completing a 3-day seminar with Equinox in Los Angeles, and I was thoroughly blown away by this stuff. So I've been really excited to get somebody like Geoff on, who's been so well versed in this stuff for so long. It's exciting, it's a little nuanced, but I think that Geoff does a really good job of clarifying what the principles are, and then most importantly, how you can enact them into your weekly routine. I hope that you enjoy this episode as much as I did. Without further ado, Geoff Rose. Well, Geoff, thank you so much for taking the time out of your schedule to be here to talk about some very important postural philosophies and things that, I'm hoping listeners at the end of this can really take home and kind of apply to their personal life, some things that have impacted my life a lot since I was able to take a seminar on ELDOAs. And I really appreciate you being here, man.
Of course. Thanks for having me.
Yeah, so I wanted to jump into a little bit of your background. So you interned at Clemson on the strength and conditioning side of the basketball team. And if I think back to, when I was getting involved in the personal training world and coaching as a former athlete, those are kind of like the dream situations, right? You go, you work alongside a pro sports team, you're with high-level athletes, and you're thrown into the mix of doing like everything that you love, and then your expression is the most athletic version of that. So maybe you can talk a little bit about your experience working with a collegiate team like that, and what kind of steered you into the space that you are now, where you own an amazing facility in New York and you're really helping individuals one-on-one, some of which may be in the athletic space but aren't side by side with a pro team like that.
Sure. So the way you described it is exactly the way I felt when I was a kid. In high school, I was a really good football player. I was a really good basketball player. Played 1 year of college football, couldn't hack it. So I, transferred to Clemson, and, I get this opportunity, and it's really great. And I loved every minute of it. It's extremely serious. It's extremely rigorous. Loved my mentors there. But the reality is that, like, when you're there, your experience is kind of downgraded, if you will, by like what you're getting out of it, if that makes sense. Yeah. And I don't mean to downplay like anybody who's a college strength coach or anything like that, but you see these guys, they're 1 year and done. They're going on to this, they're going on to that. And so like the building process, it just comes and it goes so quickly. And so from a satisfaction,
like relationship building between athletes and coaches, that kind of relationship balance.
Exactly. And so I did that for 3 years at Clemson. I coached college basketball for a few years, and I was a strength coach at Concordia College, which is Division II. And that was a great experience because exactly like you're talking about, like now I have 4 years, which each of these guys, and see them grow and get a little bit more of the bonding going on and that sort of thing. So that was really great. And, during that time, I started to make some extra money on the side. I started to take on some one-on-one clients, and it's a completely different population. So I, like you, with the Equinox background, I joined the Equinox team, and started picking up that business and so on and so forth. And I kind of realized like I know a lot, but I really don't know anything. Because when it came to like that desk jockey, I was like, I don't really know what to do with you, you know?
Yeah.
Like I'm used to like working on plyometrics and like really heavy lifting and power lifting. It's like, what do I do and how do I make you feel better and all that kind of stuff? So when I kind of started diving into a little bit greater education from a standpoint of like understanding anatomy a little bit more, understanding biotensegrity, understanding all that intrinsic stuff, that kind of changed my feel. And when I can give people like pain relief, that was like, whoa, like that made me feel amazing. You know what I mean?
Right.
So it was this different, very different kind of satisfaction. And, you know, throughout that, like you develop a totally different relationship because it's one-on-one. So I have a full hour with just this one person. We really get to know each other and so on and so forth. So that was kind of a big part of the transition.
So how does if you're in the collegiate space and you're a strength coach, let's say, it sounds like you, even if you possess the knowledge, you don't have that much of a direct role individually in the outcomes of the athlete. So
Sure.
How does that whole structure work? Because if it's always seemed, and I might be completely off here, that nuance ideas, I mean, I use like, I think it's really interesting that a lot of teams are using like the Viper now, and then they weren't before, because that's a pretty nuanced way of training and activating and warming up and getting ready for sport. But to bring new ideas into the space that is just so rooted in like old school strength and conditioning, how do you bring a new idea or a new concept successfully into a collegiate atmosphere and have it take hold?
Sure. So, good question. When I was at Clemson, we actually had two different strength coaches. We had John Sanderson, who's now at the University of Michigan. And then after my second year with him, we had Preston Green come in. And he actually left and was with Billy Donovan with Florida for a little while. And then when Billy Donovan left, he actually stayed at Florida for a long time. So I was very lucky to see actually two totally different systems. And I give so much credit to Preston because he was like, I know how to roll this thing out. He came from Stanford University, so he had plenty of experience, but he's also a Charles Poliquin guy. So he was a little bit more like on that functional end and a little bit more of like big picture thinking, as in, okay, let's just jack up, right? How much can you bench? How much can you squat? Like his programming was a little bit bigger than that. So how do you impose that stuff? It's incredibly hard. It's incredibly hard because like we hear the argument nowadays of people talking about, well, we should pay the college athletes, right? And like part of that whole thing is because like not only are they making the university money, but like it's so hard to be a student athlete where like you have classes every day starting at 8 a.m. You go straight through till about 2. You eat as quickly as you can. Then you're hitting the weight room. Then you have basketball practice. Then you have film work. Oh, and then you have to go back to your dorm room and then you have to do homework. Yeah. So reason why, you're packed. And so the reason why I bring that into the equation is you say like, how are you implementing new concepts, but also like, how are you working with people on an individual basis? It's so hard. It's so hard to do. And so like you have to make that 45-minute window that you have with these guys in the weight room like as efficient as you can. And that's why strength coach, assistant strength coach, intern, right? That's why you have kind of that little team to be like, okay, boom, boom, boom. And then, hey, what happens if someone sprains their ankle, right? They're now spending that little time that they had with you pushing weights around. Now they're going to, the trainer working on their ankle, getting the rehab. So now you're actually missing out on time like that, which, we're talking college basketball. That happens every
all
week.
The time. When you look at like the NFL or the NBA now, I mean, the NFL this year is just wrought with injury, right? I mean, these guys are getting carted off left and right. We're going into week 6, and it's just like a bloodbath out there, it seems like. The athletes are getting so good at getting athletic in the off season. They're becoming so much more proficient. The training programs are getting more individualized. And then the available NSF approved supplementation and nutrition efforts are becoming more focused to the individual. So you're getting this really, really high class individual person at performing at insane levels. And then you put them on a field together, and of course they're blowing each other up, right? Whereas you look back to like 1980 or something, and a star tight end's like 180 pounds and he's 5'10".
Yeah.
Like, you would just never see that on the field now. So
Sure.
how do sports programs, how do collegiate strength and conditioning programs, NFL, NBA programs accommodate this change in the athlete, the training programs, without adjusting, I don't know, let's say like the rule set that's going to deter people from wanting to be there in the first place?
Sure. So, and just to follow up, exactly to your point, to be very, very clear, it's the physics have changed, right?
Yeah.
Force is mass times acceleration, so everyone's bigger and everyone's faster. Bigger collisions, faster cuts, so on and so forth, which will lead to higher impacts and more non-contact injuries.
Right.
That's for sure. I think the biggest problem is this. The off-season is not long enough. So, so you know this about periodization, right?
Yeah.
The idea is to, okay, well, the classic, we'll, build a foundational phase, and then we're going to go to, a little bit more complex, and we'll go strength, and then we're going to go power, right? That we repeat the process, or, so on and so forth. Well, if we do some math on that, like, how long do you think it takes to go through one cycle? 9 months? Right? Maybe if they're a really good athlete, you might be able to get through it sooner, maybe 6 months, maybe 5 months. Well, what's the off season for these guys?
It's like 3 months.
Yeah, it's like 2.
Nothing.
It's like, like 2 to 3 months. Right. So the reality is they're actually not able to get through true periodization. So there's not really enough time to build everything and then go out and perform, if that kind of makes sense.
But that doesn't really address the physics problem, though, too, because let's say you drew that out in the off season and then they got through their full periodization and then were even bigger, faster, stronger. Do you do anything on, I guess now I'm thinking more of like a prehab rehab side. Is there anything that you can do to a joint or a joint action that better prepares DeAndre Hopkins getting clobbered in the backfield by a safety? Like, how do you address that concern? Yeah. Or do you just kind of take the L as the team and go, okay, we're going into the season, we got a roster of X amount of guys, we're going to lose 6 of them. Hopefully it's not our star players.
Sure. So I'll try to answer this question as efficiently as possible. And I'm not saying that I have the perfect answer either, because physics are physics. But number one is, and I've only trained, about 15, maybe 16 professional athletes. So I'm not the NFL strength coach who's over his career has trained 250, NFL players, right? But you know how much powerlifting I do with my pro athletes? 0. I do none. Okay. Again, a part of that is because of the periodization, but 2 is because my greater concern is the quality of tissue, right? Mm-hmm. So you talk about something like hamstring issues, or let's talk about that ACL tear, right? So like the ACL tear from non-contact comes from when you jam your foot in the ground, right? And that tibia and the fibula slide away from each other, right? And so what's going to prevent that? Well, the quality of the tissue in your foot will prevent that, because it not only creates propulsory forces, it also accepts ground force. So if it can't accept ground force, okay, it goes up the chain. Then you have the ankle, okay? Then it goes up to the calf, right? One of the most common things with ACL injuries, does the fibular head move, right? So you have your tibia, you have your fibula, and the fibula has to spin, right? If the fibula can't spin and you plant, where's all that force go? Right to the knee joint.
Right.
There's your ACL tear. So I'm kind of making that a very acute example, but if I can ensure the best quality tissue possible all the way up and down the chain, that's going to give me my best chance not to be injured. And exactly to your point, like the best part of ability in the NFL is availability. Like you have to be available to play. And so with that, like if I were to take your question and put it as efficiently as possible, it would be as elastic as possible, meaning be as fluidic as possible. And that comes to hydration, quality of tissue, and the tissue's response system. So think of something like the IT band, right? We've all like patellofemoral syndrome, IT band syndrome, all that kind of stuff. What happens over time is that IT band is super, super dense, and it gets gummed up with other muscles like the vastus lateralis, the bicep femoris, so on and so forth, and it doesn't allow for proper gliding, and it doesn't allow for proper force absorption. So if
That's
I
why
want
you
to
see that a lot in like running, for example, something that's like repetitive impact over and over and over again.
Absolutely.
Gotcha.
Absolutely. Yeah. So if I can enhance the quality of tissue, if I can make sure the tissues are all hydrated, and then obviously give them reinforcement. Sorry about that. If I can give them reinforcement, what I'll be able to do is reinforce a really good structure that's going to be able to hand those forces.
Yeah, it's interesting that in any sport, in any hobby that people are doing, I think the easy thing to think of as an individual is to get stronger, which is great.
Yes.
I mean, if you were a skier and you got stronger and you went skiing, you're going to perform everything better and hopefully at slightly less risk than you would have before. But what's commonly not addressed, and I think part of the barrier to entry here is the knowledge necessary to properly approach something. Like, you have to have your level of knowledge combined with your understanding of strength and conditioning to then be able to individualize and approach an athlete and say, like, okay, we're gonna make the tissue on the bottom of your foot more capable of being tissue on the bottom of your foot, so that in rotation, inflection, extension, all those different things, it has the durability and the response time to prevent you from getting hurt. That's a hard sell for people because it seems so far outside of the solar system of the average person who's thinking about getting better for something. But it's so instrumental, like doing the kind of the boring stuff when you're strength training, and the small range of motion, durability work, and increasing joint range of motion, and then making that joint range of motion stronger and more capable. It's so valuable, and I think that's where working with someone individually or going to a facility like yours and actually getting a diagnosis is, like, what price can you really put on that? You don't know as the average person, because you can never foresee the outcome. You never know how many times you didn't blow your knee. But everyone who's blown a knee, torn an Achilles, anything like that, it's a completely I have good friends of mine who have, torn their knees. They're not going to ever ski the same again, or don't want to. That's another thing, is it completely changes your interest, because getting hurt is such an overhaul on your life that now you don't want to put yourself at the risk of doing the things that you used to love. And we have to find a way to get concepts and theories and ideas like what you're proposing more into like the general sphere, where instead of going to your personal trainer and saying, hey, I want to lose 15 pounds for Mexico next month, you go and say, hey, for the next 40 years, I want the most durable joints and tissue that I can have. Right. And how do we get there? How do we get these messages to communicate better to the general population?
Sure. So I think on one end, just to back up your argument, is that doing foot exercises also aren't sexy, right? Like we love to like go on Instagram and see people doing like the plyo box jumps, doing really cool power lifts and all that kind of stuff. And you can make an argument, oh, well, it does translate to sport, right? Which it does, but that may not be the optimal way to get you to where you need to be. And so how do we get there? I think the only thing that you can really do is try to really educate people on one big statement, which is micro movement dictates macro movement. So if I want a really great golf swing, but I can't get my hips to move, you're never going to get it.
Yeah.
It's like, you know what I mean? So like we can do the golf swing a million times. Like, what's the point, Right. And so I think it almost seems like bodybuilder-ish, right? Like working on micro movements, but the greater quality that each joint can individually move, the more synergy that you're going to get when you're trying to create a big movement like that. So
is that really just unpacking kind of from like a developmental kinesiology standpoint that we all have great mobility when we're a kid? You go through life, you sit in the car a lot, you sit at your desk a lot, you get injured once, and all of a sudden you start to lose this mobility and function over time. And so you're taking an approach to address individualized elements of this to bring the body back online, back to kind of baseline functional mobility standpoint.
Yeah, definitely.
So are you screening? And how do you screen most clients? Is it from like a FMS approach, or do you use unique kind of to yourself tactics for that?
Yeah. I have done the plug and play method for a long time until I've gotten a system that works for me. The reason why I say it is like I got certified in FMS years and years ago, and I think there's a ton of validity to it. But time is of the essence, right? And that's for my client standpoint, and that's for my standpoint. So I do things that are way out of the ordinary. Like when I see a client and we're about to enter, whether it's an individual evaluation room or the gym floor, I'll have them walk up in front of me. Okay. And that's from behind. I'm going to see, okay, what's their gait? Are their, is the valgus calcaneus, right? Are their heels collapsed? How are they holding their spine? How are they holding their head? So on and so forth. And unless it's like a youth athlete who I'm trying to get like statistics for, what I'll actually do is just get, like a high school athlete.
Gotcha.
I have like these Kaiser machines, right? And the Woodway curve. So how fast can you go on the curve? Linear speed. I'm measuring the 5-10-5, and then I'll do like the Kaiser air runner so I can get a power, per leg. But if it's for general population, I actually try to get them on the table as quickly as I can with the idea of like, okay, passively, like what's the range of motion in your hip, right? Like, do you have an even leg length? How do your big toes move? What's the extension of your shoulder? Like try to look at range of motion of the neck. And honestly, you're from there just connecting the dots, right? So if someone's like, it's my left shoulder, it's my right shoulder, and it just so happens that their left leg is shorter and their hip doesn't move, well, okay, I think I've found part of your problem, right?
It's funny. My dad, he's 57, but he competed in CrossFit for a while, and then now he does the DECA events, the DECA Fit, and Strong, and for years he had an overhead issue, and he just couldn't snatch basically from years of building houses, just like his shoulders all messed up. And so recently he found this awesome PT in Rhode Island, and he went to her and they were doing the full assessment. He's like, it's just killing me, my shoulder. Like I can't get into extension. It gives me all these problems, less so in DECA because it's not as mechanically demanding overhead. And she goes, well, look at your legs. And he was like, what do you mean? Like, why would I look at my legs? I didn't say my legs hurt. I said my shoulder hurts. But we forget the body's a big X. You know, it's if you stand like this from fingertip to toe and fingertip to toe, so many of the issues that people have don't stem from the place where they think that is happening. Right? Someone goes, my back pain. It's probably not your back. It probably has something to do up the chain or down the chain over a lifetime of movement or inefficient movement patterns that starts to lend itself towards this little decay in the process. And then eventually it expresses itself some way. And that's how you see it when they come to you for something and you're able to go, yeah, well, look, your left foot sits an inch further. Just mechanically look, what do you think that does to your hip? And then if your hips are off, what does that do to your spine? And if your spine's off, what does it do to your shoulders? So it's
exactly.
Are people receptive to that kind of approach? Like obviously making someone go from painful to pain-free is like the golden goose, right?
Yeah.
But somewhere in between there is this building of trust, building a rapport, you demonstrating your knowledge and kind of getting to a place where they can actually be open to the idea of something different. So how do you approach that, and what is some of the feedback that you get with people? Sure.
So I'll go back to like the youth athlete standpoint first, because that's like really, really easy. But like I said before, like before I even do anything with people, like quick warm up, have them do the air runner so I know how much power they can produce on each leg. test their agility, boom, boom, boom. And then I put them through that biomechanical assessment,
Yep.
do whatever myofascial work I have to, do whatever muscle activation. And then within that same session, I'll put them right back in those same tests.
Yep.
They're always better. Always better. And I'm like, I didn't actually make you stronger. It's impossible for me to make you stronger in 20 minutes.
Right.
I just made your body more efficient in the way it can move, right?
Yep.
So that's how I do it on a youth athlete standpoint, more so for the general population. I have my iPhone, right? And I say, look, here is the range of motion in your hip, right? And I have my goniometer to measure the rotation of the hip, take the pictures of the leg length, extension, so on and so forth. And I just do before and after shots. And if they can see change within 20 minutes, they're like, geez, well, what can I accomplish if I actually do this for a month, right?
Yeah.
And I think that's kind of the sell, is like, if I can create some immediate change for you, just think about if you actually stuck with it, where you can go with it.
So maybe if we get a little more granular for a second and talk about, let's say you see a discrepancy in leg length, for example. And so you have someone lying supine on their back on the table with their feet extended and they're in a relaxed position, give their legs some shakes, some pulls, and then in a relaxed position you see like, okay, look, visually, and you can show them, taking a picture, your left foot sits a quarter inch lower than your right, just in this position, right? And they see that. When you do adjustments or stuff, what's really happening in the body? What's happening on like a fascial level, on a neuromuscular level, between that person seeing that and going, oh, I guess, yeah, that's probably smart for me to change that. And then you walking them through whatever protocol you choose, with that individual person, to then place them in a testing setting and have them actually produce more strength or power, which, like you said, it's not like you went through 9 months of periodization. They really just made some sort of change in between that. What is changing?
Yeah. So that's where we can unpack fascia, right?
Yes.
So because that is really it. It's the fascia that's adapting that will end up, right, reinforcing that leg length discrepancy. So fascia it's a really big thing to unravel, and I'll try to be as efficient as possible. But fascia is this matrix of a sheath, right? It's like some people call it like a fibrous sheath. And the idea is that I liken it to like a spider web. It's a very complex, intricate system of collagen fibers that surround our muscles, our bones, and our organs. So it's not just a muscular thing, it's a soma thing. It's a full body thing. Gotcha. And the reality is, so it's fibrous because there's individual fibers. We say it's elastic because it can expand and contract. But it's a matrix because what's in those is collagen tubes that hold water. So it's not just a solid structure, it's also involved with water, if you will. Gotcha. And there's actually, people talk about like the 3 different layers of fascia. There's, a deep, middle, and then superficial. In between all of that is hyaluronic acid that helps promote the gliding of the tissues. But neither here nor there.
This is what I came for, by the way. This is
okay. Okay,
let's
gotcha.
go deep
Gotcha.
here. No, this is really important stuff for people to understand that you're even listening to that, and sorry to interrupt because I really want to continue down on this, is it's not how something like hydration plays in that. Maybe someone just heard for the first time that there's a hydration element to their muscle tissue. Even though you and I know that, but to hear that and to start to think of the layers of how this stuff actually works, it is very complex. And that's why understanding this is so valuable. So I'll stop there because I want to keep hearing what you're saying.
No, all good. And so that's kind of it at like a molecular standpoint of what it is. And then what it does is it acts as, for our muscles, it acts as a container, right? So if we were to take our bicep and we have the fascia that's covering the bicep, and we were to tear open that fascia, we could do this with our bicep all day. Even though you say, my bicep's really tight, we could do this to it all day because it's incredibly elastic. But what either restricts it or promotes it to move is the fascia, is the container. So if the fascia of the bicep is tight, then the bicep can't go through full contraction and elongation, or eccentric, right?
Gotcha.
So with that, if we think of something like our hamstrings, right? Why do we call them hamstrings? Because there's actually 3 of them, which I know you know that, but there's 3 hamstrings. So they have slightly different lines of fiber and they have slightly different lengths. So even though we do a hamstring curl, we're actually firing all 3, but they're also help guiding, right, that our femur as it goes up and down. And the reason why I bring that up is because fascia helps separate those 3 hamstrings so that they can glide properly amongst each other. Same thing for that IT band that I brought up before, right? That bicep femoris that sits, it's the most lateral hamstring. It helps promote between the IT band in that bicep femoris, it helps promote gliding. When fascia is not hydrated or when fascia gets beat up, those 2 things will start to interlock and then they can't glide anymore.
Gotcha.
So
that's taking a joint action. The elbow's a very easy one for people to think of, and you can see in the video because if you extend your arm out and then you flex your bicep, the elbow joint closes, so it has 2 actions, and it's performed. You can see it by the bicep and tricep are doing the majority of the work there. But if the fascial tissue that surrounds the bicep or the tricep starts to get locked up for whatever reason or entangled or lose some of that slidability, then your perception is that you have a tight muscle, right? But really it's that the fascial tissue is limiting the sliding of the fibers so that they can't actually perform their action as efficiently as they could. And that's a very simple one, right? Now we talk about like the hip or the shoulder, a joint that does every action with a lot of different working parts, and you start to get fascial differences amongst those. Now we have a real problem.
Exactly.
Awesome. Yeah, so keep going on that.
Yeah. So the other things to think about fascia, right? So it's the container, right, for muscle. It promotes gliding, so on and so forth. But it also has intelligence, right? So it senses pressure, it senses heat, and that communicates back up to our nervous system. And so I bring that up because the muscle itself, right, as you know, was here Guy Voyer, the guy who mentor for the osteopathic curriculum and all this kind of stuff, he always says the muscle is just a dumb piece of meat. The only thing that really happens is you just tell it to fire and it'll fire, right? But the fascia is the intelligence that surrounds it and helps actually give it awareness, if that makes sense. And it helps give the joints awareness. So, because we also have to remember, like, ligaments are also fascia. Bones are actually very, very densely wrapped pieces of tissue. They're very densely pieces of fascia that are wrapped together. So, and this is kind of the other thing, right? Is and if I'm jumping around too much, let me know.
No, this is good. It's good.
So the other thing to think about all this is that, okay, so I have muscles, I have bones, we definitely have organs, right? And then I have this stuff called fascia, right? Well, how do I sit up, right? And you say, well, your erector muscles will help you sit up, right? But like, what's actually keeping everything in place is actually your fascia, right? Because you might have an individual piece of fascia that surrounds your bicep, right? But then it fascially is going to connect to that next joint, which will then connect to that next muscle, which will then connect to the next joint, so on and so forth. So when you think about like how we have tension in our bodies, which I know we think tension, we think stress, but it's actually things that are like, what's keeping your femur in place? What's keeping you upright? That's all fascia. It's the chain, right? The fascial chains that help keep us in place. And again, with tension, that's what creates, when you talk about sports, like how do you run? You push off the ground. If you had no tension, right, as you push off the ground in that foot and ankle joint, you wouldn't be able to create force.
Right.
So it's also like a big proponent of propelling forces and accepting forces.
Tension is a wild concept. Obviously, like things that keep us together, atmospheric pressure, gravity, tension within our body, like all of these things allow us to exist in our environment, right? And so if I rotate this chair and get up, all of those things are working at the same time, right? So gravity is going to keep me on the ground. The fascial tissue is going to help the muscles perform their actions. Pressure is going to keep my skin on my body. I mean, that might be completely wrong. I'm not a physicist, but we look at these things, and what you commonly hear is that I'm like inflexible, don't stretch enough, or too flexible. How do you think of the relationship between tension, flexibility, and mobility?
How do I think of the relationship of those three things?
Yeah.
They all need each other. Because because you can be mobile, right? And there people are always talking about like the difference between like mobility and stability, right? But like if you don't have any tension in ligaments, let's just say, right? So think of like your ankle, right? You have the anterior talofibular ligament. That's like the common ankle sprain ligament. If you don't have any tension in that ligament, you will roll your ankle constantly. And again, that will lead again, like when you're talking about sports or just like going for a run, like you actually won't be able to produce a force. You won't be able to go through those things. So while I would say, hey, yeah, it'd be really great to have amazing, dorsiflexion and plantar flexion in your ankle, right? Great mobility. You need the tension.
Right.
One can't exist without the other.
I think about that when I'm in, strength. Like I need flexibility and mobility for jiu-jitsu because it's a wildly demanding sport on the hips and on the shoulders, and a lot of your defense and your attack come from your ability to quickly get in and out of extreme degrees of hip flexion. So you have to have tons of mobility. You need flexibility to survive attacks, because if you don't have any flexibility in the muscle and someone goes to do a joint lock or a knee bar or an arm bar or something like this, just the simple action of them doing it is enough for you to want to stop. So flexibility allows you to work in and out of tougher defenses. And then in strength training, the more that you age as a weightlifter or someone that strength trains in general, you understand how important some degree of tension is. If you approach a deadlift and you don't have tension in your body, you're at a serious disadvantage and risk of hurting yourself. And so people that are hyper flexible, you actually have to be very mindful with how you strength train with them because of the lack of tension that their body possesses on a baseline. You have to focus on that a lot to make sure that when they are doing certain compound movements, that they are in a place to be able to do them. So if we think about flexibility for a second, is flexibility something that the average person, should that be the top of their concern if they have, let's say, tightness in their body on the day-to-day? If someone takes the subway to work and every time they get to work they're like, my hips and my back, like, what do you kind of say to the average person that's experiencing something that maybe they perceive it as tension, not in the sense that we're discussing it, but they think that it's tension, they call it tightness, they would associate pain with that or limitations in daily movements? What's kind of the hierarchy that you would address for that person?
So I'll try to be as careful with my words as possible, because there are things like the hip is a big one, right? It's supposed to be a mobile joint. It's involved in a lot of systems. So do I check range of motion of that? Absolutely. Do I get panicked if someone doesn't have good hamstring flexibility? Like, I don't get panicked at all. And the reason why I say it is because like you can change that. You can change that pretty quickly. And I'll almost kind of make it abstract as like, when someone says something like that, like same thing, they're on their way to work and they're getting tight, this and the other. How much water have you drinking today? Like that's my
thing. That's like a real deal. Hydrate,
totally.
Hydration levels.
Totally. Again, because if your muscle isn't hydrated, right, it becomes like what's beef jerky? Beef jerky is dehydrated muscle, right? Yeah. And so your muscles become from this like very elastic kind of fluidic thing to like leather. I can't move it.
Yeah.
And
that's
so
a great
like
example.
And so like if you're not hydrated, like you can't expect to move anyway. And if you're not hydrated, what happens to the fascia? Starts to shrink.
It's like shrink wrap.
Totally. Totally. So like that's always the first thing. Stress is huge for creating tightness, because again, like I said, the fascia has a direct connection back up to the nervous system. And so the more that you're firing that nervous system and like fight or flight, the more that fascia, it's almost like a defense mechanism, the more that fascia begins to tighten up and water gets pushed out of the fascia. So we can't glide.
So literally someone being general, if total stress on their body from work demands, family, social, like whatever, if they just don't have a positive way of managing their stress, and let's say you could do something actually like track this, like get a Whoop and have this person for 6 months track their strain, and you're like, okay, wow, we know, aside from the fact that you're communicating this to me, that you feel stressed, that work's tough, that family life's tough, we also now know from some sort of measurable metric that your strain is also very high through this period that you associate with stress. So we're going to conclude for the moment that you are a stressed person, and now we're going to enact some habit change stuff around that so that you can have some, maybe like a mindfulness practice or a nightly disassociation from like work demands or devices or whatever. You're saying just that alone, if you can bring that person's, in this example, their score down over time, their measurable mobility or flexibility would actually improve as a result of that.
100%.
Wow.
I try to give you two really good examples. I have a client who I see early in the mornings. She's like part of a startup company and she's super, super stressed. And I could tell she just kind of wasn't feeling the workout. And so I was doing one of the ELDOAs, which we'll get into. And I just noticed like there's a general ELDOA that has to do with your hamstring, right? And she just couldn't go very far at all. And so I had her lie on her back. I had her do a lot of diaphragmatic breathing, and I gave her vagal nerve stimulation. So vagal nerve stimulation, you take like a little TENS unit, like you'd see at a PT office.
Yep. Like a muscle.
Attach it to it. Yeah, exactly. Yep. Attach it to the inner ear. There's an atrial branch of the vagal nerve there, which is a part of your brainstem. And I just gave her stimulation for about 5 minutes. She got off the table and she's like, yeah, I do feel a little bit calmer. Put her right back into that exercise. She gained about like 4 inches in her hamstring flexibility.
That's insane for the average, for just people listening, to gain 4 inches in range of motion in without years of work is miraculous.
And I didn't touch her. Like it's not like I dug my elbow into the hamstring and I said, I'm going to massage this out. It's like it was just nervous system based. Like I just calmed down her nervous system, and immediately her tissue became more pliable.
That's so crazy. It makes me feel bad about not doing more stuff, which is like the worst takeaway from this is like, I need to get a TENS unit and I need to start doing this for myself. But this stuff really does work. I mean, diaphragmatic breathing is another one. At least in my training coaching career, like it was thrown around a lot. People used it a lot, but it kind of like it dies off. People implement it into their training programs and then it dies off. But I physically, personally, had clients supine, like thumb above the shoulder, locked elbow, 5 inches from the ground with their thumb, 3 minutes of diaphragmatic breathing, in, out, like prone, so they could actually feel the difference in expansion and contraction of their diaphragm, and the thumb goes straight through the floor, same exact thing. And it's crazy, insane, right? When you see it.
Yeah.
But if I'm understanding what you're saying, at that level, you're getting a neurological gain that alone is what's preventing the joint from doing what it can do. It's saying it's shutting it down for some reason that we don't really know, unless you had a lot of time and diagnosis with that person. But the stress level in their life, for example, is putting their nervous system in a state where the nervous system is saying, limit joint action, basically. Here, we're just going to, because the risk is high, so we want to shut it down. And by doing something that brings them into that parasympathetic state, the relaxation alone makes you think that you've improved something that you already had, when really you just like found a way to access it by stress reduction.
Exactly.
It makes me really want to implement more stuff into my life and recommend it for friends to do this kind of stuff. But how do you all right, so someone's in your facility, you can be one-on-one with them. You know exactly what to do. You know the position to put them in, to change, to attach the stem to the right place. You understand the physiology of the body and the breakdown, and they can see it in real time, and then the session ends and they're on their way. But how can more people without that access make these kind of changes?
It's hard. I say that because it's all very possible, but I think you kind of hit the nail on the head that it like comes down to like routines or habits, however which way you want to say it. Like when we get up in the morning, we should have a 3 to 5 minute routine that gets us going, right? Not just rip out of bed, look at my phone to check my emails and start brushing my teeth while I'm checking my phone. Like we should have a very mindful, like 3 to 5 minutes to get us in the right mindset. I would argue the same thing at night. And I'd argue the same thing like when you're transitioning from work to your home life. So that's it like on an abstract level. But like with my clients, I make sure that everyone has some sort of homework. Like I help them develop that routine, whether that's that morning routine or that night routine. And like, I know you and I talked about this before, but like that was actually a big push for me to come out with an app, is because it's like, I sit here, okay, I'll take a picture of you and I'll text you and I'll text you this. Like this way now I actually have something for somebody. Okay, boom, click on their phone. There's that 5 minute routine that Geoff was talking about. Yep. And it kind of makes it dummy proof, you know.
What's the app called?
Rep, Restore, Empower, Perform.
And so someone can go on there and basically create a profile and come up with, or at least utilize the app to develop a habit routine, be that for the morning, to leave work, like whatever parameters you set on it, but it helps them take these concepts and then instill them into their life.
Yes, exactly. So like at a base level, it's, you know, if it's a neck pain issue, a back pain issue, a knee pain issue, we have all these protocols that are anywhere, again, from 3 minutes to 13 minutes that will lead you through start to finish what you should be doing. If somebody wanted to go on there and say like, I need something specific because I have herniation at, you know, L3, L4, and I have this and that, like then we can make a customized program for you.
What is your night and morning routine? I'm always fascinated because I've spent the past 4 years developing a really clandestine one that was influenced by a lot of different people that I was exposed to, from seminars with Equinox to different speakers and stuff, that it's completely changed my life. Like starting and ending the day with intention. And I mean, you could mean that in like kind of the woo-woo esoteric sense, but it doesn't have to be that. It could be very pragmatic intention. It completely changes the structure of the first part of your day, and it also creates consistency in the end. And those two things together, they feed more stuff than I can think of. I mean, like my sleep quality's improved, my clarity in the morning's improved, my just comfort level in the evening. Like I know that through my evening mobility stretch routine, I'm doing something good for my body. I'm bringing myself back down to a more relaxed state that promotes sleep quality. So what are your staples on the beginning and end of your day?
Sure. Before I tell you that, I will tell you that during COVID, I got into the worst habit when the whole world was shut down, right? You had to, you know, couldn't work in the office and all that kind of stuff. What did I do when I got up? I looked at my phone, which is probably what like 90% of us are doing. Sit in bed and whether it's scroll through Instagram or check your emails. And like the biggest thing, like it was bad for a couple months, was I was like, I got to throw that thing out, right? Yeah. So I do get up, and before I do any of this holistic stuff, I'm not going to lie to you, I put my contacts in, brush my teeth, wash my face. But just for family stuff, I go downstairs, so I'm away from my wife and dog, and I get on the floor. I do some diaphragmatic breathing. I'll do some neck proprioception. I played 12 years of football, so I destroyed my neck in that process. So I do some neck proprioception, and then I do some ELDOA, and then I get up. That takes me about 4 minutes. I get up, get my stuff, go to work. So that's my morning routine. Now, if I get to work and I have all my programs up and I have extra time, like I'll definitely do some more mobility stuff while I'm waiting for my first client to come in. But that essentially is my morning routine. And then my night routine is actually put on the vagal nerve stimulation because it's very calming for me. And I'll do a lot of diaphragmatic breathing. And I'll follow that up by doing, which we'll talk about, ELDOA. I do L5S1. Just because that puts me in a really good position. Like my back feels great going into bed, and it helps me sleep a lot.
What are the neck proprioceptive exercises? Because I've noticed in jiu-jitsu, especially now, like training for competition, that I know I did something last year because there was an acute moment where I was going for a takedown and I missed the opponent and hit a wall. I mean, it sounds like the dumbest thing in the world, but I basically hit the top of my head and my neck went, click to the side. And for like a couple months, it was very limited rotation to the side. I could go all the way to the other. But since then, there's slight referred tingling on like the back, more lateral. That doesn't go into my arm, but it's more just on the posterior side of my neck. And I'll feel it from time to time, sometimes worse than others. But I'm always thinking in my head, I'm like, you're going to have to do two things. You're going to either have to come up with some sort of recovery, regenerative approach here and keep doing what you love to do, or you're going to have to quit because then you're going to have to get neck surgery. So like the two roads here suck, but one that sucks less is developing some sort of routine. And that sounds something that like I would throw into my morning 1000%. So what are you doing with your neck in the morning?
Yeah. So here's the problem that we have with our cervical spine, which is our head floats in space, right? So our neck is what supports our head, and it gets no feedback all day. The reason why I say that, like, if you think of your feet are on the ground all day, so it's constantly sending information back up to the brain of how it feels, where's the pressure, where are you bearing weight, so on and so forth. Your neck gets none of that. Unless you're staring at a mirror all day, which none of us have time to do. To top that all off, which we can get into, but like with our so many people working at computers nowadays, what do we all do? We protrude the chin and start to lean forward. And so after a while, what begins to happen is that your brain begins to think, this is how Geoff wants me to hold his head. So we think that now that's normal. That's called neuroplasticity, right? The idea that like, we're building these pathways of accepting that like this is how I should be. Right. But sorry, I'll get back to the proprioception. So because our head is floating in space all day, the only way to give feedback to it, and by the way, so proprioception is understanding where someone's body is in space. Does that kind of make sense? So it's like global proprioception, but then there's specific proprioception for specific ligaments, right? Yep. So like we talked about that ankle sprain ligament, right? So that has its own proprioception on a micro level scale. Right. You have ligaments all the way, going up and down your spine, and they help manage the relationship and how it all moves as synergistically, but also understanding where its placement is. And so again, throughout our day, right, we're beginning to lose that because of our posture, where we sit, texting, so on and so forth. So how do you do the proprioception? Is all you need is just some feedback. So you can do something like take your hand and do a little bit of rolling and unrolling, but the best way, and this is the way that Guy Voyer taught, it's not my technique, but is you actually get yourself on the ground. So if you were to picture somebody who's going to start a headstand, that's the positioning. So you find the center of the top of your head
in contact with the ground.
Exactly.
But supported by your palms, basically.
Exactly. Yeah. And I'm in kneeling stance. I'm not in a handstand. Totally. Right? Yeah. And you dissipate as much pressure as you want with your hands. And what you do is you just start going through the movements of the cervical spine. So you'd go through flexion, right?
So it's like
you'd go through
back and forth.
Exactly. You'd go through side bending. And then you'd go through a pure rotation.
A side bending is more like chin to shoulder, right?
Side bending is pure, like getting your ear down your shoulder. So like this is torsion, which.
And so you're saying it's right? I think the really important thing here for anyone, if like, disclaimer, don't try this unless your doctor tells you to. But
Yeah.
if you do try it, the hand support is very important, especially for someone who's never done this. Like if you're on your knees and your hands, let the hands take 99% of the weight, and then your head and neck very little. Obviously, if you're like a collegiate wrestler, these guys are going to do it in a tripod position with no hands to build the neck strength. But the goal in this instance is not neck strength, but it's proprioception of your head as a unit, and the attachment either at the floor or the hand. And obviously starting with your hand is better than the floor, but it's that pressure down that gives your head a unique experience that it's not getting when it's out in space.
Correct. It's
connects to what's happening in your cervical spine. And so this actually teaches your brain the extension of the ranges that it has in every direction.
Yes. Yeah. So basically that ground or that hand is going to act as a feedback mechanism.
Gotcha.
So those ligaments will start to understand, this is what I can do. This is what I'm capable of. And this is my tension, right? That's it. That's my range of motion. And I go back, right? And with that, so not only are you getting like information with those ligaments, but you're also getting a huge demand of blood flow. Because that's the other thing. Like so many times, like when we're stressed, right, we just get stiff. It's this chain reaction with pain. Well, okay, I'll move less, right? When it's actually because it's promoting movement. What happens when you work out, right? You're increasing circulation. So you're increasing circulation to those muscles in the neck as well.
It's so funny to say that, because like you look at let's not even go elderly. Let's say you're looking at a 40-year-old, right? And you can tell. You just look at someone, and you can tell from degrees of rosacea how their blood flow is in their face, the way that their shoulders sit, their trap engagement in a static position. I mean, there's so many tells in body language of how someone's body is, how their blood flow is, how their joint actions are. You can kind of just, even before you get them in any sort of assessment, how that person's going to move relatively, right?
Yes.
Because there's all these physical tells that when your body starts to lose these baseline functions, like it can't be overstated that all the stuff that we're talking about, this is stuff that everyone, just barring some sort of either degenerative disease, inherited neurological disorder, or anything like that, these are things that everyone has when we start. And it's life that jacks them up along the way. And so if you don't have any addressing of these things, then you just end up in such a bad, painful space. Because your body can't exist in space the way that it is designed to do so. Yes.
Yeah, and that's, like if you want some like phrases or gems, like I always talk about motion is lotion, right? Yeah. Like you want something to feel better, like you should move it, right?
And move it in a I feel like sometimes, you go to a yoga class, right? This is a great example, because people go, I need to be more flexible. I got to go to yoga, because that, for whatever reason, even though that's not what yoga is about at all, it seems to be that's how you get flexible. Right. Go to a yoga class and take stock of how many people are seemingly relaxed. Very few. You're going to see a lot of people straining, struggling, trying their hardest, going beyond their threshold of ability to try the next hardest move or the progression. And unfortunately, it's instructed this way in a lot of instances, where someone would be like, we're going to do this, but if you want the progression, if you went to yoga and you did only what your body allowed you to do, and tried to just focus on your breathing the whole time, to be able to even just control your breathing as a baseline, to even just do that, let alone do that and maintain movement patterns throughout, it would be a wildly different activity than what you really see out there. Is just general inability to calm down.
Absolutely.
Yeah. Go ahead.
No, I was just going to say, as far as yoga goes, like, I'm guilty of, I don't do it as much as I should, but like, I have ELDOA and I have my own stretching routine, like that kind of gets me there. But like, for me, it's like, I need yoga for de-stressing, because like I'm I'm a stressed person. That's just who I am. Like my brain's running 100 miles an hour at all times. So like yoga for me is more about like the diaphragmatic awareness, the awareness of my body and where I am in this moment, you know. That's what yoga needs to be about. You know?
It's a big thing to be able to, even if you're, maybe yoga's a turn off to you, or playing sports is painful or something, but just getting the motion is lotion phrase is very smart, because it's true. Even something like walking for a sedentary person has a big impact compared to being sedentary, or finding something that gets you to move. If it's pickleball, gets you out on the court going laterally, and you're someone who only moves going forward all the time, that's a huge, huge difference. And hopefully making a choice to go out and do something like that, then you'll realize that there's varying skill levels, and you'll realize that pursuing your fitness and your wellness outside of the court will have benefits on the court. And so it can be this positive life cycle of wanting to do things. Totally. I do really want to touch on, and maybe you can just, from a high level to as granular as you want, break down ELDOAs, because I think that these are phenomenal movement patterns. And my exposure, it kind of sounds like your client on the table. We did a seminar with Michelle Dalcourt, who founded Viper. And one of the afternoons we spent only on doing ELDOAs. And I had never heard of them before, even as he was, and I was so on board with him by the time that he started talking about these. I was just eating out of his hand. And he started to explain ELDOAs, and it seemed like such an odd and simple yet wildly complex approach to posture. But like your client on the table, we did a couple things, and I was floored. I was like, oh my God, that was kind of one of those miracle aha moments where we did something so simple. And especially someone who was, growing up as a skier, tons of compression at the lumbar, trampoline training, tons of compression at the lumbar, never really having anything that was actively creating space outside of a super specialized, expensive facility, right? Where it would go as an athlete. So from whatever angle you want to take, breaking down what ELDOAs are, and then we can talk about some of the application, and hopefully by the end of it, some take-homes that maybe people can even try on their own as a little tester.
For sure. So ELDOA is an amazing technique that's very comprehensive, and it's a French acronym that stands for longitudinal osteoarticular decohabitation of the spine. Depending who you talk to, people say that last S is actually for stretching or strengthening. They can be interchangeable. But that sounds like incredibly complex, and I don't really understand it. All it means is that's fitness, yeah. All it means is creating space. So what I mean by that is there are some joints, like the hip joint's a really easy example. It's a ball and socket. If I do the ELDOA for the coxofemoral joint, all I'm doing is this. I'm just creating more space in that joint. And so what happens is, so we have these vertebrae, right, that are stacked, and in between them are discs. And what happens throughout the day, when I sit in that chair all day, is that our spine gets compressed through gravity. And what we can do, I'm watching you, man. I'm watching you. And what we can do is, we've already talked about fascia in this podcast, is we can actually use those fascial chains to our advantage to create maximum tension in our spine in order to create what some call decompression. But in this case, we can do decohabitation, or create space in a specific joint. So when you look at these things on the outside, and I'm sure you know this, like they look like yoga poses, which is like, whatever, it's cool, it's not the end of the world. They look very easy, but if you have the intention that you have when you do the ELDOA, they're incredibly hard.
Yeah, co-signed.
Co-signed, there you go.
Because
yeah,
that was, for me, when we first did them, and I saw him demonstrate, I'm like, that's just an easy yoga pose. And then when we were walked through it, right, by like a practitioner like yourself, someone who's professional, understands it. Exhausting, yeah. Totally. Surprisingly exhausting.
Yeah. And so what you're doing is like, let's take like T6, T7. I'm sure you did the one, right? Fingertips together, reach up to the sky.
Yep.
Right.
Overhead.
Yeah. So like the example of that is that we are creating as much tension as possible in the body, but based on where our arms and our other limbs are located, is that we can actually focus on a specific junction. So what I'm going to do is I'm going to take T7 and I'm going to lock it.
So
and
that's
then T6.
thoracic vertebrae.
Yeah.
7.
Sorry, yeah.
Thoracic vertebrae.
Yeah.
6. So for those listening,
Exactly.
middle of the back, not the big thick ones by the pelvis, more in the middle where your spine can twist and rotate, but not your neck.
Correct. And so what we can do is we can lock the joint above, and then we're going to pull the joint. Lock the joint below and pull the joint above to create space. And when that happens, we're actually creating a suction mechanism that pulls cerebrospinal fluid into the disc. So it actually can rehydrate the disc. The other thing is if someone has a bulge or herniation, it can actually push the bulge back into place, or it can help, right? Herniation is when the fluid is leaking. It can help push fluid back into the disc and help it heal quicker.
So if I'm the skeptic listening right now,
Mm-hmm.
has this been studied, proven, shown that like in real time, or is this an idea?
Let's put it this way. There are no American universities that have done long studies on this thing.
Gotcha.
So you can't go online and say, did Nebraska University, what did they find on, you can't find that for sure. But what I can tell you is as I started my studies on this, my mom was sadly involved in a bad car accident. So she got some bulging discs in her neck. We put her through ELDOA. She saw Guy Voyer and boom, boom, boom. Okay, do ELDOA for these 2 vertebrae. She got another MRI 3 months later, and the disc was pulled back into place.
So I mean, that would suffice. Obviously, this is a one-off situation, so it's a little bit not as stringent. But so this person is going from having a bulging disc, so fluid is leaking from the disc. That's known, right? And then through doing this protocol, they obviously got to work with the creator, so that's a unique situation too. You're seeing the same person in an MRI again, and the fluid that was previously leaking is now not 100% restored, but is restored to a noticeable degree. And
Correct.
I would assume your mother's movement patterns are improved a lot.
Absolutely. I also have 2 other hard examples, which is I do a lot of work with kids as well, and some of them are hardcore athletes and other just kids who want to be in shape. But I've had a few kids that have scoliosis, and so they come in. Okay, here's my X-ray. Here's where my curve is. One kid years ago was able to change his scoliosis by 3 degrees. So it's the same thing. He came in. Here's his degree of rotation, based on where the apex of his curve is. We figured out a calculation to do where specifically to do the ELDOAs for. Changed it by 3 degrees.
Which is, again, massive.
Massive. Especially too, because he was 15. He's almost finished growing. When you're 7, 8 years old, you can change that very, very quickly. Not when you're that age.
So I mean, this is a little bit of a sidebar, but in that instance, so that seems like a really powerful partnership for a osteopathic facility or a doctor or general practitioner. So is that like a referral based thing where they're like, hey, we see that your kid has scoliosis. We know Geoff and his facility has worked to improve this with other patients. We kind of recommend that. Or did they say to the kid what they told me before I ended up having chest surgery when I was a kid, but they would just go, looks like it's scoliosis, maybe not, but I don't know, it should get better as you get older.
Yeah. So I'll bleed that into my other story, which is I have another kid he's in high school. He has a double curve, which is hypothetically actually better than a single curve.
Yeah.
Exactly. And one of his curves was really bad. We changed it by 7 degrees.
Jeez. So
he went from his doctor telling him, if it doesn't change, we're going to put you in a brace. So that scared the life out of him. You're going to put you in a brace. So from that end, I'll say the doctor had no idea what ELDOA was, and he could care less. But when he took that second image 3 months later, he says, oh my gosh, you actually have a change and you don't need to be in a brace anymore. So I just bring that up because I don't have an ego. everything is fine with like my career and all that kind of stuff, like doctors don't they don't want to believe in that kind of stuff. They just
That's what's so disappointing to me. It's like it's okay. Your job is to help public find safety, recovery, improve their health, and develop, like a game plan for how to overcome something. So, and I've had plenty of instances myself where I've gone in facilities, some of the best in the world. Like I had a back issue, and this was actually coincided with time that I was doing these seminars, and I went into Santa Monica Orthopedic Center, which is great. I mean, they deal with, LA's top athletes, and the facility was phenomenal. They were, customer service was fantastic. The in and the out, everything was great. But the time with the doctor was really disappointing because they basically said, yeah, look, they go, oh, you skied for years. That's what's wrong. Whatever the thing is that you told them in the process, they're going to use that against you, right? So they go, oh, you skied? Yeah. So you have a bulging disc here, and they showed me. And the end of it was kind of like, are you going to stop doing what you're doing or not? And like, I'm sorry, but that's not a solution for me. This is my life. No, I'm not going to stop. And their take on that was kind of like, well, then, monitor your pain, manage your pain, and then hopefully you won't have to get surgery one day. But if you do, by the time that you do, medical advancement will be so much better that it will be safer. And I'm like, man, you should be able to take someone like me who's like a low risk, I'm not at risk, right? Because your suggestions are like super long timeline. And then pair me with a facility that does this type of work. Yeah. And gets me to teach my body from a neurological approach how to improve. And maybe it's not 100%, but I don't want 100%. I don't want to be in pain the rest of my life, right? So even if we could improve it 15%, and then I had some homework stuff that I just did on my own all the time, that's a place that we need to get to, so that these low level, kind of like low risk, you don't need surgery right away, you don't have to stop playing right away, go see Geoff, go see another practitioner XYZ who's versed in this kind of stuff, and let's do everything that we can on our own first to try to create length, and then in many instances it works anyway.
Yeah. And that's actually like, I try to be careful because like there are a lot of really good doctors out there, right? But I think the problem is like with the insurance model and how these doctors actually make money, they need to see as many people in 1 hour as possible. Like that's the name of the game. So exactly to your point, like 5 minutes, okay, yeah, man, I wish you good luck. Just come back in 2 weeks. We'll see if it's better, And like really the model should have layers to it. It should be here's, the doctor with the overall assessment and diagnosis. They should have a physical therapist on staff. They should have a massage therapist on staff. And then they should have a personal trainer on staff. Like if you actually did something like that where you built those layers, people get better not only faster, but like the problem goes away. And that's kind of the issue is that like, hey, I got to look after myself. I got to run my business as a doctor. Right. Like, so, it's hard. That's all I have to say. We'll
circle back to the ELDOAs as I sidetrack my own personal doctor experiences. But so how many patterns are in the ELDOA library?
Yeah. So there's an ELDOA for every single junction in the spine. So
and it's specific to from the head to the pelvis. This is all ELDOA is spinal focus. This is not an approach for. Use the example of ball and socket for the hip, but it's not necessarily an approach for the hip. It's specific to the spine.
Yes and no. So there is an ELDOA for every single junction in the spine. So C0, C1, C1, C2, all the way down, right? You can even though the sacrum are fused vertebrae, you can actually still do ELDOA for the sacrum joints as well. Just because it's good to get a lot of fluid in there, and sometimes they do get a little stuck and off kilter, but you can also do it for the proximal joints. So you can do it for the shoulder, the glenohumeral joint, and you can do it for the hip joint as well. And again, because it conceptually is just about creating space.
Right.
So, and those are ball and socket joints, so they work with the ELDOA to create that space. But lastly, and this is the surprising one, and this is something that's interesting for endurance athletes and rotational athletes, is you can also do the ELDOA for the ribs.
I was just thinking like ribs, lungs, like oxygen intake, expansion.
Totally, yeah. So that rib attaches to the spine, and it has a degree of rotation. And what happens a lot, again, through stress, through not movement, so on and so forth, is it kind of loses that mobility. So you can actually do ELDOA for the ribs, create space, increases the quality of the tissue around it. But also, again, if you talk about like a golfer, you can get a ton more rotation in your swing if you do ELDOA for the ribs.
So I'm thinking too, like if you have someone, I mean, you know, assess 99% of the people walking around and their breathing patterns are just horrible. So
Correct.
if you're super shallow in your breath statically, obviously you're not going to get better at breathing as you exert more effort. So your shallow breath is going to be more repetitive shallow breath. If you take someone and you can improve the space around where their ribs attach to their spine and give more expansion and contraction to their rib cage, then you're going to allow more compression of the diaphragm, and then now you're going to allow that person to actually take in and expel more oxygen and carbon dioxide. And so you could take someone who's stressed out, high stress, super tense, shallow breather, get them to understanding diaphragmatic breathing, get them to do some ELDOAs for their rib attachments, and then combine those two things over time to improve their breath patterns by way of skeletal system, but also therefore decrease their daily stress level.
Correct. And it also reinforces, like we dropped the name neuroplasticity, right? It also like reinforces, like reminding your brain, this is how I'm supposed to breathe, not shallow, right? I'm supposed to breathe rhythmically, if that makes sense.
And that's an important thing for people to consider too, because I think the red flag that gets raised all the time with things that are a little bit nuanced is that it takes time, right? Things take time. It takes time to lose weight, not because it takes time to lose the weight. It takes time to change the habits that are promoting the weight gain or the inability to lose weight. So with these kind of things, it's not that the ELDOA can make more length in one session, but the neuroplasticity is the part that's going to make more length for your lifetime. And that means you have to commit. You got to do this stuff. And that's where people go, I don't have the time for that, or that's too expensive. The irony, of course, is that whatever you're, whatever you forego now, you're going to pay at some point.
Correct.
Whether it's years off your life, whether it's surgery, whether it's doctor visits in the future and healthcare premiums, whatever it is, by foregoing the investment in your postural integrity now, it's not going to get better as you age. That's just a fact. Yep. But how do you get people on board with something like the ELDOA? How many tools do you need to give themselves so that they can do stuff on their own? And then how much of that as a business owner, as an intelligent coach, and as someone who cares about all your clients, how do you manage that relationship between what you do with them, what they do on their own, and kind of the graduation program to get this neuroplasticity to stick so that then they can actually go about their life and have less pain over time?
Sure. So if you were to go to somebody who really wanted to lose weight and you looked at their diet and you said, well, okay, no more soda, no more fried food, no more this, no more that. You go through this whole list and like, here you go, don't do that anymore. Like work. It's hard. It's really, really hard. And I just bring that comparison up because it's like, if I were to give you 20 corrective exercises and said, do these 3 times a week, go.
Yeah, it's
like they're not going to do them. So I start very, very small. Just do this one thing every night before you go to bed. One thing, right? And okay, we start with that. Okay, now here's 2 things. Now here's 3 things. Or okay, do these 2 on Tuesday nights and do these 2 on Thursday nights, right? So like split it up a little bit so you're not doing the same thing every night. So it's this kind of like very slow build. And if you can just get that commitment for that one, then you'll start to be able to build on it.
Do you take, if someone comes in, do they run ELDOAs for all parts of their spine? Does it become very specific to a pre-existing injury, or are there kind of general approaches that most of us should be doing, given the fact that here you and I are sitting in a desk despite our professions, and we've been here, for an hour and 15 minutes, and we'll be here longer.
Right.
Are there just kind of basic general takeaway things that people should be considering about these with regard to their spine?
Sure. So that's a good question. If someone comes in and they say, hey, here's my MRI report, I have a bulging disc at L4, L5, obviously we're going to do L4, L5. But if somebody comes in with like general back pain, I don't have an x-ray, I don't have an MRI, that sort of thing, obviously I'll do the assessment, so on and so forth. But like, you're always going to do something like L5, S1, because that's where your pelvis meets your lumbar spine. So we want to create that foundation as best we can, right? We want to make sure that foundation is as balanced as possible. It's like that's always a go-to. And then the other go-to is so we talked about how there's ELDOAs for every single junction. There's also an ELDOA that's actually active. It's like you'd almost like look at it like dynamic. And that one is for overall spine, right? Like all the fascia around the spine. And it's the best at getting cerebrospinal fluid up to the brain. Yep. And so like that one I also do for everybody because it's a really good like warm up. It's like a really good warm up for your workout. It's a good warm up for your day. Like that's a big one that I always do. So yeah, totally. Like if someone is kyphotic, right, like slouched over, and I don't know if they have scoliosis at a specific junction, right, I'll just say, okay, like we're going to do the middle of the thoracic spine. So we're going to do T67 and T8, T9, because those are like, if you can.
12, 7. There's 24 ELDOAs.
Yes, as far as like base ELDOAs. But then again, you have the sacrum, right? So like S1, S2, S2, S3, right? But then you also have like, if you have a herniation to one side, there's actually a variation. So if you have a herniation to one side at L4, L5, you can actually change the posture for that specific side of the herniation. How
do they study this? Like, how do you get this? Because this seems, again, to be like a skeptic, this seems really conceptual. Like, okay, I know what I know about discs, fluid, skeletal structure, fascial tissue, neuroplasticity. I can garner that these movements or these specific postures they create length, and so if you lengthen this or do that or the other thing, you can draw the conclusion that there's being, improvement to this. So before we put on top of that someone actually making physical progress or them experiencing it, are there no studies that can be done that like really vet this and prove it to a medical degree to where it could then be applied to more of like an academic setting or more of a, like, I don't know, like a facility setting?
Yeah. I'm going to make a really wise comment to you.
Yes.
The reality is, of course there can be, and there should have been, and there should have been years ago. But there's two problems. One is it's Guy Voyer's technique that he invented, and he's from France. So the support that he has in this country it's not the same. It just doesn't. The other thing is, okay, so I've explained ELDOA to you, right? And do you need any equipment? No, you don't need any equipment. You don't need any, there's no medication you have to buy. There's nothing to buy. So who makes money off of that? Yeah. You don't make money off of it. So like a pharmaceutical company or a big physical therapy chain, like, isn't going to buy into it because they can't make money off of it. Does that kind of make sense?
It's almost like I always feel like I sound like a conspiracy theorist, but when you just step back, anyone steps back, and you actually look at how the healthcare industry, the medical device industry, the pharmaceutical industry, and the actual physical building, the hospital, and how things are run, when you just look at them from a macro perspective of how they're integrated within each other, it's not even, there's no conspiracy theory. It makes sense why they operate the way that they do. Why would you want to bring in something that has no market for equipment, no market for a sales team, no need for the person to come back? it's going to take money out of the industry. And
Absolutely.
it's so sad that that's the way it is, and that you have to go to super kind of like fringe specialty facilities in some cases to get this kind of stuff. It's just, it's
the way it is.
It seems like such a tall mountain to climb.
Yeah. And by the way, just as a side note, because you're asking before about like how you get people to buy in. Well, what's very sad about like what I do, and like my mentor, I've also studied functional neuroscience for 6 years, and like he doesn't have a title, right? He's just a really smart guy who I learned it from. He learned from a very good neuroscientist. But I bring that up because like people who see like myself or like him for pain management are people who are desperate. Like it's people who already went to that doctor. It's people who already went to that physical therapist and just couldn't get the results. They're like, listen, I know you only take cash, but I'll try it. You know, something's got to work.
Yeah.
And that's kind of why people are motivated, because they become desperate. And exactly to your point, like you said before, is like sometimes you go to a doctor's office and like, yeah, it looks pretty bad, but like, just come back to me in 2 weeks and we'll talk about it again.
Yeah.
You know, like,
the idea of like preventative. I've felt in the past at some points like preventative care really make big strides, and then other times where I feel the disgruntlement. And I guess it's worth saying, like, we need hospitals, you need pharmaceuticals, we need Western medicine. Like, let's just be very clear about that. There is a time and a place where you want that kind of care 100%, and you don't want to have to pay the full amount for it. If your arm gets really damaged in a car accident, you don't want to go do ELDOAs for a 90-degree fracture out of your arm, right? You don't want to go rub, like, I don't know, essential oil on a joint when the joint's missing because it just got obliterated by a brick wall or something like that. You need instances where you can go and get extreme levels of care. You need instances where you can go and get diagnosis and prescriptions for certain things and vaccines. All of this is very important. But it's disappointing that on, let's say, a high school athlete who's a healthy, competitive athlete who's putting their body through the ringer to excel in their sport, they should have part of the curriculum, part of the available resources that they have should be things like this. Preventative care utilizing something like an ELDOA. So that an athlete like myself, when I was in high school, just getting banged up for 6 years straight, creating God knows how many, down the chain issues, that I could have been spending time going and doing something like this. It's really proactive, and in the end, very inexpensive compared to surgical opportunities or like specialty care facility, some that for many people aren't even available because they're not even covered by insurance. So the problems that propagate and get worse and worse and worse, and then end up really bad, that could have been prevented by something like even like myofascial release or ELDOAs or something else, now becomes a problem that has to be dealt with by some extreme specialty measure. I hope that more, conversations like these and awareness to functional approaches to medicine and functional approaches to wellness and preventative care become more popular, so that the individual can then make the choice on how they want to handle that.
For sure. And that's also kind of too, it's like the really harsh example of like that kid with the 7-degree, the scoliosis that was really, really bad. We got him in a position where he doesn't have to go in a brace anymore. Like, if we didn't change that, like if we just said, you'll put a brace on, like he might be the candidate when he's 50 to go get spinal fusion, right? Because it's like, it's out of control. It's affecting your heart. So we're going to fuse it, right? So, okay, versus let's say he only did a 12-pack with me and that cost him, $1,600, right? Versus like, okay, I'm 50, sure I have insurance, but like that surgery in total is going to cost $80,000 and I have to pay 10 of it, And
like, you're 50 and you're getting open, basically spinal surgery at 50. Like the risk of surgery, the technology to perform it and the methodology will improve in our lifetime for sure. It always does. And it improves at a great rate because they're integrating more technologies. But the reality is getting surgery at 50 and getting surgery at 25 are two very different things in terms of your recovery, how you come back from it. Also just the mental the anxiety of being put under later in your life. It weighs heavy on a lot of people to commit to that. And especially then you had loved ones and other things. And so something that, again, seems so simple on the front end, it has this big waterfall effect later on. I use myself as an example because I had pectus excavatum surgery when I was 16 to pull cartilage off the left side of my sternum, the left side of my ribs, push everything back together, metal rod stitch from rib to rib that was kept in for 6 weeks. And then later I had an outpatient where they made a 1-inch incision and they cut the sutures and they pulled everything out, 46 staples, there was like 30 stitches, and then I couldn't do anything, and I was like this for basically, a year. And granted, in hindsight, I think a lot of that experience and the insecurities associated with it led me to really pursue a career in like wellness and fitness and everything. But that experience of going to the hospitals when we were in Colorado and dealing with doctors that would, they just have me hold my knees, bend over, look at my spine, do x-rays, wasn't really enough to call it scoliosis, but there was clearly some overgrowth on the ribs, and that was doing something to the sternum, but it was new until we found the doctor who did it, who pioneered the surgery out of UCLA. And we came in, he's like, 100%, this is what you have. He showed us excavatum, carinatum, he showed us the whole spectrum of things, and he said, we'll do this surgery. That surgery now is done in 3 hours, outpatient. Mine was 8 hours, 3 days in the hospital. I look back on that and I go, I've been able to still perform athletics and do things in my life. But what if I hadn't? What if that surgery had clipped something? What if the recovery of it was worse? Or also, I don't know the future. So perhaps what issues would this kind of give me in the future as I get older? Because there's limitations. I feel it. I mean, my chest was cut open from here to here. So it's, could I go back and approach something like that with something like ELDOAs and work on, tissue release and adjustment and more of like a homeopathic approach to it to get my ribs and my spine and my sternum to all better understand each other? Because it's not like it was growing at light speed and it was like, we got 5 days before this thing goes south. We got to handle it now.
Yeah, sure.
It had developed over time. I probably had some postural and habitual things that I was doing that made it worse. So I feel like what you do and what you're practicing, it can have a huge application in that arena as well for earlier diagnosis of things that I didn't need surgery when I was 16. I wanted surgery when I was 16 because I was sick of everything that I had to deal with it and the anxiety and the insecurity and all that and the limitations and the pain. But what you do can actually solve those things.
Totally. And that, that's an example too of like, I've also been through the process where like, okay, visually on someone, I can see scoliosis. They go to a doctor and the doctor says, well, I mean, I kind of see something, but you don't have scoliosis. Like, it doesn't meet the American standard of what scoliosis is. Right. And I'm not trying to divulge too much, but like I bring that up because like something like your situation, like if somebody were to catch that when you're really young, like 4 or 5 years old, there's a lot of manual manipulation that could have been done because you're just so moldable at that age. Yeah. That wouldn't make it, zero, wouldn't make it like, oh, it's perfectly even now, but like it would bring you to a position where you're like, I'd have to look for that in order to see that you have that, if that makes sense, Yeah,
and that's like the craniosacral work on, my sister had craniosacral work done when she's a twin, my brother and sister are twins, and when they were born, they did manual therapy when she was younger, but to 100% effectiveness. If my parents weren't kind of the nuanced like hippies that they were, I don't know if they would have gone like this homeopathic cranial sacral kind of like woo-woo approach, but it was flawless because they caught it at a point where the body was malleable.
Correct. Exactly.
And that malleability changes as everything that we talked about happens. You get older, lifestyle habits, movement habits, all these kind of things. Do you feel like there's a path to integration of getting your type of work more central to the healthcare system?
It's a really good question. I think the only way it would would be out of desperation. And I just bring that up of like, when I think of the future of like what people are going to be fighting against, it's definitely postural issues, just because of sedentary lifestyle, but also again, because like our lives are more about our computers and our phones than anything else, right? Like, you know, for the regular 9 to 5 day. And so I think only out of desperation, being like, how many people can we cut open? People don't want to do surgery anymore. Like, I think that's going to be the only way. I know that's kind of a harsh statement to make, but
harsh,
I
but
don't see it any other way.
Yeah, harsh, but I think it's true. I mean, even I think about this, right? Like, this is as someone who's lived a career upright, moving all the time, interchanging things, carrying different loads, transitioning different planes of motion to, you know, 100% of business is virtual now for me. Even as a trainer, everyone that I train is virtual. There's no in-person, partially now by design, but the pandemic created that.
Yeah.
And then capitalized on it. But then I look at that sometimes and I'm like, that's a lot of hours, you know, seated or recording episodes. And the value of doing the episode is incredible. But the seated version of it, you know, this is a conversation that in the past would have been in person just by necessity. There wouldn't have been a way to do it over the internet. And so I think you're right. As we get, that's why things like this are so important. You know, anyone that's listening, if you're 30, if you're 40, if you're anything, it's never too late to implement some sort of protocol to help prolong your posture, because when your body goes, when things get taken away, you don't get them back to the degree to which you have them right now. Sure.
And it's, by the way, it's no different than financial education. Like, what do they say? Like, when you're 20, start investing $150 a month and you'll become a millionaire by it. But like, it's literally, this is no different. Like, if you actually start like good habits, good routines, taking care of yourself, healthy diet, exercise, like those are the things that like you'll be like physically and mentally rich when you're in your 50s, when everyone else is going to start doing this, you know?
And it's fast.
It's fast.
That drop is fast. I was talking to my dad about this because he's, you know, how many, there's not, in the DECA competition field, there's like 10 dudes globally that you know, compete that are 57. And it's like, it's lonely to some degree, it's lonely at the top. Like, he's taking care of himself his whole life. So he's doing competitions that are physically demanding in his 50s, but you look to the right and you look to the left and it's like 20 and 30. So there really aren't, but it's not because people don't want to be, it's because their bodies aren't allowing them.
Right.
And that's a very different thing to be up against. When you want to do something, but your back pain prevents you. When you want to do something, you can't play pickleball because your knees hurt because they're in pain all the time. Or you don't want to play basketball because if you get hit the wrong way, you might have neck pain or referred pain or back pain. So implementing these tactics and taking care of yourself on a morning routine level, on an evening routine level, whatever that minimum amount of time is that you can carve out in your day and apply to yourself, which actually, that's a good segue unintentionally on what if you were to send people home from listening with maybe a reference or a place that they could go and maybe hear more about this or watch more about this on top of your app. What are some things that they could implement from the ELDOA library to most readily impact their posture, maybe combat the 9 to 5 desk work structure, and start to see some changes? Sure.
So the only problem with ELDOA is that because the intention, well, the exercise itself is very complex and you have to have the right intention. It's very hard just to say, hey, well, you know, hey guys, right now think of this and blah, blah. Like, it's a little comprehensive, and that's one big thing that was really hard. I have it on the app, is like how to do very specific ELDOA postures. But I would bring it down a notch and I would say, hey, the biggest thing, start working on diaphragmatic breathing, right? Like that would be the biggest thing. Like, the next biggest thing is like, okay, how do I increase my awareness of my posture? Like, have a neck routine, have a routine for stretching your neck. What's the base of the neck? What's the foundation of the neck? The thoracic spine, right? Start going to the gym and start doing some glute hams, start doing a lot of extension exercises, right? Like those are like base things that you can kind of Google search on YouTube and that sort of thing. But like outside of that, yeah, it needs to be someone like myself. There's a lot of us out there, ELDOA practitioners, that can actually kind of guide you through it. But then once you get it, you got it. You can kind of go on your own and do it on your own. But that's kind of the idea of the app, is that like there's an introductory level of these ELDOAs in these, you know, neck and back pain protocols that are very specific for that posture. Yep. And then from there, we can slowly start introducing other ELDOAs for you.
So one that we did was, I think we were cued as if you're holding a bowling ball above your head, and you drive up, but you have to exert the effort to press the ball away from you, and then when you get to the end range, you like push even further, and it felt like it took so much effort to get this invisible object further away from my head, but in the hold at the end of it, and I may be missing a step here in leg position or something, but it felt like, I mean, it would be akin to be sitting like this and then doing that. Like that is the extension that it felt like in my body from a static position.
Sure. So like from a cueing standpoint, it's called axial extension, right? The idea of creating a lot of length. I always liken it to pretend Geppetto's behind you, and he's pulling the top of your head to create you as long as possible, right? So like when I talked about like the T6, T7 positioning, you sit, what the kids say now, crisscross applesauce or Indian style. You gently drive your knees down to the ground. You get axial extension, really good diaphragmatic breathing, abs are relaxed, fingertips touch. You start over your head, right? Making sure that that spine is nice and flat, nice and long. And then you go into as much elbow extension as you can.
And that effort is there. It's present at the top. Like when you say you're driving up, you are driving up. You're trying to literally touch the ceiling, as much effort as you can possibly exert.
Absolutely. And like superficially, you're like, that's easy. But again, because we're so used to this kyphotic posture all day, then those muscles in your back are turning on, those erector muscles, and they are on fire. And that's really what it becomes about. Because like, I'm kind of cool here. As I really start to put tension, right, on that thoracolumbar fascia, right, as I'm reaching up, that's when it kicks in. Like, oh my goodness, this is hard, you know.
And for the diaphragmatic protocol, do you use, if you send someone home to do diaphragmatic breathing? Because that's, I mean, if there's something easy that every single person can do that you can learn to do on your own with pretty minimal effort, the way that I used to cue it, and I cue it, is to do like hand over hand prone on the ground to relax your head, forehead on the hands, chest and stomach in contact with the ground, legs flopped out or in, whatever allows your pelvis to relax the most possible, and then draw in through the nose for as long as your breathing patterns can allow. But while doing that, as the breath expands, you drive the feedback is that you drive your stomach and your abdomen and ribs into the floor through the expansion. And then as you exhale, it's easy to teach someone because you can press on their back and on their sides for them to feel the expansion contraction. But if you're doing this by yourself, as you exhale, you let yourself collapse even more into the floor. And so you're training that peripheral feedback on your abdomen to learn how to, it's called diaphragmatic breathing, because you're using your diaphragm, which if you can take a breath in, your diaphragm's going to do its job, but it's learning to have control over that process to expand and contract within the rib cage. And someone doing that, how long do you have them do it? How long do you recommend someone starts with? What should they work up to start to get that nervous system to calm down a little bit?
Sure. So the first part is definitely about awareness. So you can almost use that like as a gym exercise where you want to say, okay, let's take 10 breaths, let's take 15 breaths, so on and so forth. But exactly to your point, it's more about the awareness. So like the face down positioning is really good. Again, just because you'll feel your rib cage kind of pushing into the floor. You feel your abdomen pushing into the floor. The other thing that we do is we can also go on our backs, and you can put one hand on your chest and one hand on your belly. And so even though at that moment you don't have specific contact with the rib cage,
Yep.
you're actually getting used to belly breathing, if that kind of makes sense. Because people so much through their chest. So it really starts to, with your hand on your belly, you can feel that kind of awareness of, okay. And then you can go hands on your rib cage to the side in that same bridging position and think of an internal fight. So you're going to push into your rib cage with your hands, and your rib cage's job is to expand and push it out. And so
what do you say to someone goes home, and what they don't know this, but what they end up doing is just pushing their stomach out and pulling it in without having any change in their diaphragmatic height or depth.
Yeah. I mean, that's the stuff that's like really hard. That is why, in-person coaching is so powerful. But I think that's the idea of, like, the reference point is when you take a breath in, you're putting that pressure into your belly, for an example, like fill the paper bag full of air.
Yeah.
And then when you breathe out, let the paper bag collapse. And like, you can actually do it. Like, you can do it with a weight, or you can stand over your client, put pressure on their belly and say, hey, I'm going to fight you. Right. And it's kind of like, it's like teaching a kid to throw, right? If he doesn't know how to rotate his body, put boxing gloves on them, right? And they'll learn how to rotate real quick. If you give people some reinforcement, some feedback like that, they'll get it. They'll get it pretty quickly.
That one I like a lot, if you're doing it by yourself. And I'll even do this now from time to time, especially as I was teaching myself to nasal breathe through activity, was tying a loose rubber band, like a monster band or some sort of resistance band, around the abdomen to transition learned patterns from a prone position into more dynamic settings, so that you can take like your diaphragmatic breathing pattern but then put it into something like a deadlift or a squat or a clean or just something with a lot of movement where you can get back to that fight or flight pattern really easily. So when you have the 360 circumference without the need of your own arms, you can feel that, and you can feel how it changes, because as the heart rate ramps up, it does become more difficult to notice and feel where that breathing is going. But that is, for sure. I mean, if anyone can implement something now, today, this moment, is learning how to breathe that way. And I've, like I said earlier, I've had clients literally, and especially ones that are high stress. So clients that are working in California for a company in New York, doing trading, that type of thing, come in and start their sessions with diaphragmatic breathing. Seems so silly. Why am I paying you to have me lie on the ground here? But the difference it would make in their session, in their ability, one, to even be there physically, mentally, but then two, to get in and out of patterns that were very limited for them, it is a huge difference. And all you need is 3 to 5 minutes.
Totally.
It's a game changer.
Yeah, absolutely.
Well, Geoff, it's been, I did not think that we would go an hour and 45 minutes talking about posture and how to create more length, but this has been a welcomed and awesome conversation. I really, truly hope that anyone listening can take some of these things home and start to apply them, or feels motivated to integrate some sort of routine on the front and back end of that. So I really appreciate you taking the time. And if anyone is looking for Geoff, his facility, everything will be in the show notes, so you can find his website there, his contact in New York. Yes?
Yes. Yeah. Yep. Westchester, New York, just north of the city.
Awesome. So thank you, Geoff, so much for your time.
Thank you so much for having me. This was great.